Hey everyone, welcome back to my channel. I'm Sheila G, the PAC, and if you want to know what the heck might be growing around your eyes, you're in the right place. As always, if you find this video helpful, don't forget to like, comment, and subscribe to my channel for all things dermatology content. Let's get right in. So let's talk about some of the most common lesions that occur on the skin around the eyes, starting with syringomas. Now, these are benign tumors of the eccrine sweat glands that present as small, flesh-colored bumps that often form in clusters around both eyes. These may also occur under the arms and less frequently in the genital region. These are asymptomatic, but a lot of patients like to have them removed because of cosmetic reasons. So these can be cosmetically treated with electrocautery, and then sometimes tretinoin is prescribed to reduce the size of these lesions. However, any topical retinoids like tretinoin can be very irritating, especially around the eyes, so you must take caution. And then we have milia cysts, which are very common on the face, especially around the eyes. Now, these are benign cysts that contain dead skin cells or keratin that's trapped underneath the skin, so they look like white little pearls. Now, milia may also be seen in about 40 to 50% of newborn babies, and we call that neonatal milia. In babies, they often occur on the nose, anywhere on the face, and even the scalp. But in babies, they tend to just go away on their own after a few weeks. Unfortunately, for adults, they tend to not fade away on their own. They just kind of sit there in the skin. Milia may also occur in areas of previous trauma where the skin has healed. For instance, I often see these on previous surgery scars. Now, milia are asymptomatic, they're benign, and don't require any treatment. But to cosmetically treat these, we basically unroof them with either a needle or a blade and squeeze out the contents. Other treatments include, again, tretinoin. Tretinoin treats everything. Electrocautery, laser, and even chemical peels. Then there are hydrocystomas, which are not as commonly seen, but still occur around the eyes. Now, these are thought to be due to an obstructed eccrine sweat gland, which forms a small cyst that's filled with fluid. These often occur on the eyelid margin or the corners of the eye and present as a dome-shaped, kind of grayish to blue color, but sometimes they are more translucent. Now, these are completely benign, but they can sometimes mimic basal cell carcinoma as they might have some similar features. So it's always important to get your spots checked by a dermatologist. Now, hydrocystomas are typically drained, and so that can easily be done with either a blade or a needle puncture, and that fluid is drained out and then the lining of the lesion is removed. Then there are xanthelasmas. These are yellow, soft bumps or plaques on the inner eyelids known as the medial campus, and they're actually due to cholesterol deposits in the skin. So these are from a lipid disorder such as high cholesterol. These lesions are slow growing over many months to years and again don't have any symptoms. Now, high cholesterol can be due to a familial disorder or a secondary disorder such as obesity, diabetes, liver issue, or even certain medications can cause it. So when I see somebody that has these, my first question is always, do you have high cholesterol? Now, some patients are already aware of their lipid disorder, but not everyone is. So it's very important to perform a lipid panel to test for high cholesterol levels. First and most important treatment is to treat the underlying lipid issue. Now, for a more cosmetic treatment, there are several things that can be done, including electrocautery, liquid nitrogen, sometimes chemical peels with trichloroacetic acid, and then even laser treatments can help with this. These can also be removed surgically. Next are hordeolums, otherwise known as styes. These represent a bacterial infection of the oil glands on the eyelid margin and present as red, painful bumps that often start like a pimple and then get larger and may even drain pus. Styes happen very acutely, meaning quickly, and are very tender, and a lot of that inflammation may lead to eyelid swelling. Styes often go away on their own eventually, but to help facilitate that, we do recommend warm compresses applied to the area for about 10 to 15 minutes multiple times a day. And sometimes erythromycin topical ointment is prescribed to help with the bacteria on the skin. Other common lesions that we can see around the eye include skin tags, seborrheic keratoses, which are age-related thickenings of the skin, benign moles, and freckles. But it's always important to get these lesions checked out by a dermatologist because skin cancer can occur in these areas as well. Now, there are many other lesions that can occur around the eyes, but these are the most common ones that we see in dermatology. As always, thank you so much for watching. Don't forget to like, comment, and subscribe to my channel for all things dermatology. I'll see you next time.